very concerning is that the number of patients in the ICU with COVID-19 is now the highest it's ever been across the state at any point during the pandemic. After a lengthy conversation with the requesting hospital, had a long conversation looking at all the data in the situation, and did recommend that we activate crisis standards of care. Subsequently, I declared crisis standards of care for North Idaho and the Panhandle and the northern central health districts be activated.
We will consume every single bed and every single resource we have with COVID patients in our hospital. Our ICUs are not only full, they're overflowing. The vast majority of our patients in our intensive care units are COVID positive. 98% of them are unvaccinated.
The number of patients in hospitals, particularly up north and here in the Treasure Valley, is actually higher than when we went into crisis standards of care. In a lot of ways, we're still in a worse situation than we were when we first declared crisis standards of care. The number of cases remain high, but are declining. And hospitalizations remain high, but with continued encouraging downward trends. Today, I am making the declaration that crisis standards of care are deactivated for all public health districts except the Panhandle Health District.
That's just a little insight on how far we've come just this year alone, but you heard it there. A big announcement today from the Idaho Department of Health and Welfare. Most of the state of Idaho is now moving out of crisis standards of care. That is everyone except the Panhandle Health District, which includes Boundary, Bonner, Kootenai, Benewah, and Shoshone counties. Now, Health and Welfare enacted statewide crisis standards about 2 months ago in September, and they held a news conference this afternoon with local hospitals to answer questions as to why we are no longer in crisis standards of care for most of the state. And this afternoon, our Andrew Bartline listened into really all the context and explanation behind it. So, Andrew, I'm curious, how are things different today? I know that there's concerns with stuff going around the holidays and with more cases possibly coming up with people getting together.
Yeah, it's exactly what it is, Joe. And it's simple fact is our hospitals are no longer overflowing in the ICU. And St. Luke's even said they're encouraging staff to take some time off. This is because staff to patient ratios are returning back to normal, and attention can now be given to people that have had treatment or surgery delayed through this surge. St. Luke's says they have more than 7,000 delayed surgeries, and it will take up to 6 months to make up the lost ground on that delayed care. And to be clear, that's not to say that it's an easy task. Hospitals are still stressed, and COVID patients are still a big role in that.
It's not mission accomplished. Instead, this is a moment, we think, where we can collect ourselves, reflect on the innovations that we implemented, the things that we've learned, and pivot looking forward to how we're going to stop history from repeating itself by making wise decisions.
Now, I'm curious, Andrew, because a number of weeks ago here on the 208, as we just highlighted, we had told our viewers it's worse now than it's ever been. And that seems like, only a matter of weeks ago. So I guess for some context, I'm curious, what do the hospitals look like right now in terms of COVID patients? I know for a long time, the COVID patients were really overwhelming the amount of care, and percentage-wise, there was a lot of COVID patients that needed care. I'm assuming it looks just drastically different now?
There's still a lot of COVID patients that need care. Dr. Souza says 20% of hospitalizations are COVID patients. So, Joe, that's like a fifth of people coming to their hospital needing care have COVID. In the ICU, that's up to 40%. And these numbers are a little lower with St. Alphonsus. 33% of their ICU patients have COVID. So COVID's still playing a big role, and it's contributing to a lot of hospitalizations. As for getting out of this, positivity testing rate is a measurement that our local healthcare systems have leaned on. And it's kind of a simple logic, Joe. The less likely or the less frequently people test positive for COVID, the better you are down the road. And it's sort of like a 2-week span that they're looking ahead with that. So this is a look at our all-time positivity trends. You can see that we peaked in early December of last year, and then we began to trend downward until about the middle of June. We hit our low, 2.8%. And that's when we came and started to climb back up rapidly. Early September, we hit our peak, 17.4%. 0.3%, and that's just right after enacting crisis standards of care. And now this is just statewide. Some counties were seeing higher percentages, some more than 30%. Today we are down to 7.3%. So Joe, a year ago we're seeing some positivity rates nearly 20%. And the ideal number that we've heard from St. Luke's and St. Alphonsus continuously is they want to be around that 5% mark. So that's an ideal place to be. And we've been well above that. We've been below that. Right now we're on a downward trend. And even up in the Panhandle, Health and Welfare says that Kootenai Health is trending downward in cases and hospitalizations. So right now there's no word on what the timeline looks like when we could be out of crisis standards of care in the Panhandle, but they do say we're trending in the right direction. And I believe the term Jepson said, the Director of Health and Welfare, is in the near future. So headed in the right track.
It's really an important takeaway, too, that, the term is, are we out of the woods? And the answer is sort of. But as we talk about just how far we've come, it's so interesting to me that a year ago, again, that 20% positivity rate meant that 20% of all these people getting tested were positive. I mean, that's a lot of people in our community that were testing positive for COVID. And now, as you mentioned, far, far less. And I really think that tells a big story.
Yeah, 7.3% is much more manageable. The goal is 5% continuously. We've heard that's the direction they want to be in. So wait and see. And of course, you see those tests and you kind of wait 2 weeks out and see if you can get those impacts and head in the right direction.
And we know it's not over. COVID is still very much with us. We're seeing that there are some states out to the west, Colorado, for example, that they're kind of seeing what we were seeing in September now. So again, I always like to mention this, Andrew, I almost called you Brian. A big thank you to our frontline medical workers who are still working through this. I thought it was interesting you mentioned that they're encouraging employees in our hospital system now to take that much needed time off, because as we reported, so many of them were working long shifts, 7-day weeks, very difficult circumstances, and it's really comforting to hear that they say, please go take the time off. We don't need all hands on deck at this point. But still, a serious situation, Andrew, we'll be keeping an eye on. I appreciate your report today. Thank you.